Hi there, and welcome to the clinic. I hear you have been having some health concerns. Is that right? I see. Well, I'd like to ask you just a couple of confirming questions, and then we can get into that. All right? So, you could just give me your name and date of birth. Wonderful. And is that your preferred name? How do you like to be addressed? Excellent. So, tell me a little bit about what has brought you in here. I'll just be jotting down some notes if need be. Okay. Alright. I see. And anything else you can think of, even if it might not exactly seem relevant? No. Okay. Wonderful. So I think for what you've told me, we're going to give you a bit of a general workup, see if we can find anything out of the ordinary, if that sounds good to you. Good. So for this examination, I am going to need to be touching you. Is that okay with you? Do I have your consent to do that? Wonderful. So let's go ahead and just start by looking at your face. So let me come in here and I am going to just take a little feel around here. Excellent. So this spot right here. Anything of note I should know about this? Okay, you already know. And it's just a bit of inflammation there. Do you often get this sort of redness here? Okay, so you do know about that. Good. Good. Just wanted to make sure. We want to try to solve any and all problems that arise. Let me keep looking here. I'm going to have a more detailed look at your eyes in a few moments. Now I'm focusing on the skin. And this part has just a bit of a different texture. You aware of that as well? Right in here. You are. Okay. Good to know. Good to know. I'd rather be over observant than under. Right, so while I'm here working with your general face area, let me just take a peek at the lymph nodes. We'll start behind your head and work around the head and neck. So right under here. This is the occipital node. Here you can feel the occipital ridge. And then we have the postauricular nodes behind the ears. And preauricular in front. We can get into submental, submandibular, under the jaw, and take a little detour to the parotid gland. And then we'll come down into the anterior cervical, posterior cervical, deep cervical chain here along the neck. And then all the way down to supraclavicular above the clavicle. I see. So those look all fine. There's no distension at all. Everybody feels nice and just barely palpable. So I'm going to take a look at your sinuses. That seems to be a bit of a common problem as of late. Everything blooming and releasing pollen. Some people get really irritated. All the congestion. So I'm going to be first palpating the frontal, ethmoid, and maxillary sinuses, and then we'll get in some direct percussion. So let me know if this is painful or tender at all. If I press in. Around the forehead, above the eyebrows. Any pain or tenderness with this? No. Let's get into the nose with the ethmoid sinuses. Anything there? And maxillary. Anything there? No. So now I'll be doing some direct percussion, which will involve me tapping along the different sinus areas. Do let me know if this is painful or tender. This is a bit of an accentuation maneuver, if you will, in that sometimes even if you press on the cavities, they might not feel sore at all, but then when you start tapping, that's when you can feel it, right? So I'm just going to How is that? And that? And maxillary. And that. Very good. Now let's move on to looking at your eyes. Oh, I have a light here that is a little bright. And I'd like to look at the pupillary response of your eyes. Bring this in. Let it go. Bring it in. Let it go. Bring it in and let it go. could just have you look at this light here. I'm going to be bringing this in. There you go. Just look with your eyes. Don't move your head. And out. In. Excellent. And out. And out. Switch to this side here. Keep following the light as we come in. And out. And in. And out. And in. And out. Good. Accommodation reflex looks very good. So I am going to bring my light in, and I just want you to look at the light using only your eyes without moving your head. So look up here. Good. And down here. Over here. Good. And about right here. Right there. Good. Right here. Right here. Excellent. Right here. And right here. Good. About right here. What if we bring this over here? Just keep following the light as best as you can. There we are. Just keep following. Good. And does any of this feel like you have any restriction in movement? Do your eyes feel any strain? Does it feel like they're doing any extra movement? That maybe they're shaking a bit, giving a bit of a shudder. Good. Yes, I can't see any nystagmus. You've been able to go in all our cardinal directions of gaze. Good. And right in here. Right in here. Yes. Your pursuits and saccades have been good as well. So I'm just going to come in real close and let's take a look around the eyes here. So I assume that you haven't had any trouble with your vision, as you did not mention that. Is that correct? Good. No declination in vision, visual acuity. And what about the actual eye? Any abnormal sensations? Burning, itching, watering, irritation, change in color, light sensitivity. Very good. So I am going to be pulling down on the eyelids. If I can have you look up. Pull down, you look up. Good. And I'm going to pull up and you look down. Just taking a peek at the conjunctival tissues. Good. I'm going to take a little look here at the lacrimal gland. Lacrimal meaning tear. These are the tear ducts. Good. And our eyelashes intact, good distribution, as well as the eyebrows. I'm going to be just pressing in around the orbital ridge. Let me know if this is painful. Excellent. So let's go ahead and move on to your ears. So that was one of your particular concerns. So tell me a little bit more about that. What is it you notice that has made that worse? What makes it better? Is there any particular time this happens? Or is it all the time? Mm-hmm. Okay. I see. Well, I'd like to take a little look, a little inspection of the physical ear of the pinna. Take a little look inside, and we'll do a little bit of testing, right? Sound good? Good. Oh, let's take a look at the ear here. Have you had any other abnormal sensations, pain, fullness in the ear, itching, irritation? All right. So the outer ear looks clear, and I'm going to take a look behind the ear. I'm going to pull that back and look for any skin abnormalities. It's primarily what we see here. The other ear. Is any of this painful or tender as I'm poking around a bit? No. Very good. Let me look behind the ear. Just move that behind. Good. Doesn't really seem to be anything back here either. Let's do a bit of an otoscopy where we'll have a little look inside the ear. I'm going to be pulling the pinna up and back to straighten the ear canal. Not impacted in any way. It looks quite clear, actually. I think we'll have to do a bit more investigating in terms of maybe finding, pinpointing the particular sound you're having issues with. That is quite curious. So I'm going to have a look at the other ear. Then we'll do a little bit of testing. See if we can narrow down what might be going on. Go ahead and pull this up and back. When did you say this had started? let's see if we can get that narrowed down a bit more on the outside, externally, physically. Not seeing anything out of the ordinary. Your ears look quite nice, actually. They were quite a pleasure to examine. So let's see what I've got. Here we go. So, I've got a selection of tuning forks. We've got one that is quite high-pitched, one that's a little more in the middle, and one that's quite low. I'd just like you to tell me if any of these in particular sound more or less clear than another does. Start with the high-pitched one. This is 512 hertz. Coming in loud and clear. Good. Loud and clear. Good. Let's test the mid. I see. Good. And the low. Well, I think we are going to real quick conduct a Weber and Rinne test just to possibly rule out some kinds of hearing loss. So I'm going to strike the tuning fork and firstly put it right at the top of your head. If you could just tell me whether you hear it more on one side, the other, or bilaterally. One side, the other, right in the middle. One side, the other, right in the middle. Good. Side, the other, or both. Yeah, that one was a little soft. Let's try that again. One side, the other. Good. So now I am going to strike the tuning fork and put it on the bony process behind the ear. And then you just tell me when you stop hearing it. I'm going to bring it in front of the ear and let me know when you stop hearing it. Hear that? When does it stop? Hear that? Stop. Good. Hear that. When does it stop? Good. Hear that? When does it stop? Good. Hear that? stops. Good. Good, good. So, those tests were fine. I am just going to have you tell me whether you hear one of the tuning forks on the left side or the right side. What side do you hear that on? Mm-hmm. Good. Let's go with the mid-range. Good. And the high. Excellent. So there didn't seem to be any issues with that. That being said, if this is something you do feel is concerning to the point you wish to pursue it further, I can absolutely give you a referral. Let me just turn it down. Let's take a little peek at your nose, mouth, and throat while we're here. If I could have you just tip your head back. There we go. Just gonna take a rather cursory look as you didn't have any issues with your nose. Generally, if you do, you would know. And if you could open your mouth for me. Good. Just having a little peek. And I'm going to grab my tongue depressor here just so I can look in the pockets of the cheeks here. Inside of the lip. Would you mind just lifting your tongue to the roof of your mouth? We can see underneath there. Good. Okay. And you can lay that back down. And if you could just stick your tongue out as far as you can. Look at the throat here. If you could say ah for me. There we go. Good. Throat looks good. Back of the mouth looks good. Okay. Excellent. So let's grab the stethoscope. Listen to the heart and lungs. I'm going to have you just breathe normally. I listen to the heart, starting with the aortic position and the pulmonary. Good. The tricuspid. And the mitral. Good. And now I'll direct you how I'd like you to breathe so that I can listen to your lungs. You can just take a deep breath in and out. Deep breath in and out. Deep breath in and out. There we go. Deep breath in and out. Easy does it. Deep breath in. Deep breath in and out. Deep breath in and out. Good. Have you been having any issues with shortness of breath or wheezing, feeling it hard to breathe? Chest pain? None of those. Very good. So I'm going to take a listen to your abdomen while I've still got the stethoscope in. I'm just going to have you breathe normally. I'm going to spend a few seconds at each spot, listening to the internal organs. And going kind of all over the abdomen, leaving no stone left unturned, if you will. Mm-hmm. Good. Mm-hmm. I'm going to do a little palpation of the abdomen. So I am going to use one hand to start. And let me know if this is painful or tender at all. Sometimes just the act of pressing into the abdomen can be a little sore. It's not an area we like to have pressed into. It feels antithetical to what we would want there. And now I'm going to go in a little deeper. I'm going to use both hands to press in. I'm going to have you take a breath in and out. Breathe in and out. Breathe in and out. There we go. Now that one can be quite intrusive feeling, so it's a good tip to try to breathe through it and focus on your breathing, and it's over in just a few breaths. So last thing I want to do with you is just test some of your reflexes with my tailor or tomahawk hammer here. So if I could have your foot, please. Good, and I'm going to hold on to it. I want you to let this relax as much as possible, and I'm going to hold it how I need it. So I'm going to start by tapping my hammer on the back of your foot. We'll start with the Achilles tendon. I'm just going to have you keep relaxing. There we go. If I could have your other foot, please. Good. So same thing. Let your foot relax, and I'll hold it so that there's a little bit of tension with that tendon. And I'm just going to tap the back. Good. There we go. Just like that. So for the knee, I'm going to have you just let the leg go floppy as best as you can. And then I'm going to tap on the patella. There we go. Okay, so both knees look good there. If I could have you take your arm and rest it on your thigh here and let it go floppy. Let the arm relax, let the hand relax. I'm going to come behind. I'm going to be tapping right back in here. Do the triceps reflex here. Just let the arm, let that go floppy. Then we'll just... Good. And if you could do that for the other arm. Just hold it across the thigh. Let it go floppy. Just going to shake that a bit. Make sure the hand flops around. Good. No tension. Just all relaxed. There we go. Good. Now I'm going to hold the arm. I'm going to be putting my thumb in the crook of the elbow and tapping on my thumb there with the reflex hammer. If I could have your arm, and we're getting kind of good at this. Just let it relax. Just let it relax. Just like that. Other side. Arm relaxes into my hand. Elbow relaxes. Very good. Now just for funsies, I'm going to put my thumb right here, and we are going to do the jaw jerk reflex. If I could have you very slightly open your mouth, put my thumb right here. I'm just going to tap on it. Now the fun thing with that is nothing's supposed to happen. If something does happen, there's a bit of an abnormality. Nothing's supposed to happen. There we go. So Now, did you have any particular questions? Okay, so about your concerns. So we had already established that you did want a referral out for your ear concerns, but in terms of everything else, I found nothing out of the ordinary, nothing to suggest that there would be anything to be concerned with. Even with your ears, there wasn't anything I found, but what you had described is certainly worth a second opinion, worth a better examination, a more thorough one. So other than that, I think that you are as healthy as can be, and I can get that referral written up. So I will get that put in, and you will likely get a call within, I would say, 3 business days. And if you don't hear from anybody by, let's say, next Monday, then I will have you call my office, and then we can give them a bit of a nudge and see what's going on there. Does that sound okay to you? Wonderful. Excellent. Any other questions? Okay, very good. So I'd like to thank you so much for coming in today, and I'm glad we were able to take a look into your concerns. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content